Can you hear what your heart is saying? Welcome! Let's explore the heart's sounds. S1 is the lub at the start of systole. S2 is the dub at the end. S3 and S4 follow. S2, closure of aortic and pulmonary valves. ECG shows end of T wave synced with dub. S2, the second heart sound, marks the closure of the aortic and pulmonary valves at the end of systole. This creates a sharper dub sound, best heard at the heart's base. During inspiration, increased venous return delays right ventricular ejection, causing a split in the second heart sound. In atrial septal defect, a left to right shunt increases right heart volume, delaying pulmonary valve closure. This causes a wide fixed split in the second heart sound, independent of breathing. Inspiration delays the pulmonary valve. But in paradoxical splitting, like with aortic stenosis or LBBB, the aortic valve closes even later. A ventricular gallop, or S3, is an extra heart sound after the second beat. It indicates blood rushing into an overfilled or stiff ventricle. It occurs when the atria cast lub-dub rhythm. This often indicates underlying heart conditions. The heart's valves ensure one-way blood flow. The mitral and tricuspid valves control flow into the ventricles. The aortic and pulmonary valves control the exit. This diagram illustrates the heart and key vessels. The aorta carries blood from the heart to the body. The pulmonary artery sends blood to the lungs. This is Core Clinica. Like, share, and subscribe for life-saving tips.